I'd like to give you some helpful hints that will improve your oral hygiene, some hints on brushing and on flossing, as well as on cleaning your tongue. Obviously, the first thing that you want to do is brush your teeth. And, formerly, we used to use a very hard toothbrush to stimulate the gums. And that was found absolutely not necessary to do. Just proper brushing stimulates the gums enough. And now we tell patients to use a soft toothbrush. You can go into any drugstore. Basically, all the toothbrushes are soft. You can certainly use an electric toothbrush, or really it's a battery-operated toothbrush. And some of them use a rotary motion, some use up and down, and quite frankly, I don't think that makes any difference. And you can certainly do a good job with a hand toothbrush. Let's talk a little bit about toothpaste. And you'll notice I've got where you cannot read the label on this because I'm not advocating any particular toothpaste. But anyway, a white toothpaste is a milling surface and can actually wear the tooth if you have created recession on it. But if you use a gel such as I've got here, and what I want you to notice is how little toothpaste I put on there. Actually, that's even too much. Because what you do, you often see advertisements where they'll put toothpaste like this and another like that. And the problem with that is that you get all these suds in your mouth and you're trying to hold it in and you really can't brush. So I'm going to kind of show you the brushing technique that I personally use in my mouth. So I start in the back posterior and I almost put my teeth together, because if you open wide, you see how the cheek comes down and you cannot place the toothbrush. So let me show you a beginning brushing. You'll notice I can even talk to you the way I'm brushing. And it's sort of a rotary motion, going around like that, coming around to the front, switching to the other side. And you'll notice I'm not getting all foamed up. And notice how close my upper teeth are to the lower teeth to allow me to get behind that tooth. A rotary motion, a rotary motion. Because as we get older, and we tend to have a softer diet, and certainly when we get into a mental state where we've lost it, you tend to get gum line decay. You don't tend to get it that much on the lingual, but on the facial of the lowers and on the facial of the upper teeth. And notice that I can even talk to you while I'm brushing. But can you imagine trying to do this with a mouthful of suds, and certainly on the inside and on the lower front teeth and around here? And I actually do this sequence probably about twice. And I probably spend a minute to a minute and a half doing that. Now let's summarize proper toothbrushing technique. First of all, keep the teeth close together. The posterior teeth should be almost touching so that you can release the cheek and get behind those last molars. In brushing, I like to use a circular motion to remove the plaque right at the gum line. Number 3, I emphasize using a small amount of toothpaste or tooth gel. For if you use too much, you create foam and you cannot actually brush properly. The second phase of oral hygiene deals with cleaning between the teeth. Now, if you think about it, there are 6 surfaces of the teeth: cheek, biting surface, and tongue. Those are cleaned with a toothbrush. But if you don't clean between the teeth, then it's 40% of the tooth that's not cleaned. And therefore, you really cannot have good oral hygiene until you remove all the bacteria that you possibly can. So flossing is probably the most effective way of doing that. But let me tell you why patients say they don't like to floss. First of all, they say, my fingers are too big, I can't get them in my mouth. Secondly, they'll say, it hurts when I floss. And number 3, it causes my gums to bleed. Well, if the gums bleed, obviously there's inflammation there, which is because of the bacteria left in the intermiddle area. So let's deal with each of those individually. Number one, my fingers are too big to get in my mouth. All right, let's deal with that problem. First of all, you need to get a piece of floss or tape as I'm using here, and I really don't care which one you use. I personally like to use a dental tape. And you'll notice that this piece of dental tape is about 15 to 18 inches long. Now let me explain to you why patients say, my fingers are too big to get in my mouth. Look at this. You can't get in your mouth until you wind this down between your fingers so that the working area is only about a half an inch. So let's start flossing in the upper arch. First of all, don't do this because that impacts on the gums and can make them sore and tender and possibly bleed. The other thing before I start, I want to emphasize something that is the key. Remember what I say now. You don't floss using two fingers. You use only one finger and the other finger is dead weight. Now let me show you on this upper left how that works. I'm going to come a tooth forward so you can see. Notice how I saw and worked that between the teeth without popping that contact and impinging on the gum. Now, when I floss the front surface of this bicuspid, notice that this finger is dead weight. And I'm only flossing with the finger on the tongue side. Now, when I want to do the back side of the other bicuspid, notice this is dead weight. And then gently put the floss through. So let's go all the way back and let's floss around to the front. Now, on the upper front teeth and the lower front teeth, notice that there's little space between that needs to be flossed because these teeth are much narrower. So I actually spend less time doing that. But you notice I'm only using one finger. We're over on the right side now, and I'm flossing with this finger, then I'm flossing with the thumb. But the finger on the tongue side is just dead weight. You're just flossing on the right side with the first two fingers, depending on whether you're doing the front side or the back side. Notice. Front side, back side. Front side, back side. Front side, back side. Now, if you don't pop the contact, you're not going to hurt the gum. And if the gum bleeds on flossing the way that I've showed you, that means that there is infection and inflammation there. And if you will floss properly for less than a week, all that bleeding will go away. Now let me summarize what I've told you about flossing. Remember, one of the things that patients say is they can't get their fingers in their mouth. So remember, you need to wind the floss around the middle fingers so that the working area with the floss is only about a half an inch long. And when I begin flossing on the upper left, then let's say we're doing the molar, you will notice that the lingual finger on the tongue does not move. This is stable. This is dead weight. And on the facial, we use the first finger on the front surface of the molar. Then we use the thumb on the back side of that bicuspid. Let me repeat that. First finger, thumb. First finger, thumb. And on the other side, we do exactly the same way. We work the floss, dead weight, first finger, thumb. So that's the way you floss. And let me add that if you do get bleeding on flossing, that shows that you're not removing the bacteria between the teeth, and you will continue having bleeding until you start flossing. Hopefully that will be helpful to you.